Dr. Nina Yu, POS instructor. Here I'm going to show you how to bond the brackets on the lower for the aligner series. This is a hands-on for the aligner series number 2. So when you get your supply, I lay them out here. What we'll need is the lower model, which will have the aligner on there. So you will actually remove the aligners, but be careful not to touch the surfaces of the teeth, otherwise you will contaminate it and it might not bond so well. Okay, so what we need is the bracket holder, and there is one that's the molar bracket holder that looks like this. This is used for the molar brackets, and then the rest of the bracket holders are here. Those are used for the brackets from the lower 5 to the 5. Okay, so we're gonna follow the standard setup height that's gonna be posted on the IAT website. So the molar bracket height is at 4 millimeters. Okay, molar bracket height will be at 4 millimeters. The lower 5 bracket height will be at 4 millimeters. Lower 4's bracket will be at 4 millimeters. Lower canine bracket height will be at 4.5 millimeters. And then the lower incisor bracket will be at 4 millimeters. So for the bonding, we will need Transbond XT. And inside of the Transbond XT, there is a light cure adhesive primer. And you need a brush and a handle, and then the Transbond XT adhesive paste. So when we start with the bonding process, the first bracket we need to place is always the molar bracket. Okay, some of us get in the habit of bonding the lower incisors, but we should be bonding the lower molars first. So how we pick up the lower molar bracket is you squeeze the handle so it opens. Once it opens, then you can either grab hold of the bracket base from occlusal to gingival like this, or you can use the tip of the bracket holder to grab the occlusal and gingival part of the bracket. Okay, so the method I prefer is using the whole bracket, and using the whole bracket holder to grab the occlusal and gingival tie wings. It's more stable. Okay, so you can grab the bracket first, just be very gentle with it so you're not clipping on the side of the bracket, which can actually fly off. So you can set it aside. Before you start the process, the first thing we need to do is use the adhesive, and you can add a small drop and just a very, very thin layer onto each of the surface. So when you bond this in a clinical setting or a similar setting, we just wanted to brush a thin layer on the buccal surface where we're gonna be putting the bracket. Okay, so I'm gonna do 3 at a time. Okay, and then you should let it dry a little bit and then give it a very, very flash cure for about 1 to 2 seconds each. Okay, then you hold the molar bracket. So the molar bracket, the ball hook is pointing distal. Okay, because in a clinical setting you won't be able to place the bracket onto the tooth in any other direction except having the ball hook pointing to the distal. Okay, so the next thing we're going to do is to put the cement, and when you put cement on the back of the bracket, it's always better to not just do a big blob of bracket cement, but you need to spread it out to cover the entire bracket base like this. Okay, so once it's on, then you can gently place the bracket onto the molar, and once you place this on, you need to use the tip to squeeze the cement out. And what I typically do is I just use the tip of this holder to kind of tease off the cement. Because you do not want to leave excess cement. Okay, you can leave it there. So how do we determine the height? The height is determined from the occlusal plane. So there are two methods that you can do. If you have access to the molar, then you can pick up a 4mm bracket holder, and on the side of the bracket holder, it will show you 4mm height, and you can position the bracket holder in this way with the flat surface on the occlusal plane, and this bottom part of the bracket holder should rest in the bracket slot. So for the molar bracket, the bracket slot is closed, so you'll have to estimate where that bracket slot is. Okay, so you can put the top of the bracket holder over the occlusal table and check to see how far you need to move the bracket down so that this is 4mm away from the occlusal plane. Okay, so you won't be able to fit this into the bracket slot. However, you can estimate to see where the bracket is, where the bracket slot is, by positioning the holder this way. Okay, so it looks like the molar position is going to be further gingival, which is what we want it to be, at 4mm from the occlusal plane. So once you have positioned the bracket, the next thing is you need to make sure that this bracket is onto the tooth, aligning with the long axis of the tooth. So if the long axis of the bracket is not aligning with the long axis of the tooth, then you will have some movement of the crown or the root in the direction you don't want it to be. So then you can adjust the orientation of the bracket so it is aligning with the long axis of the root. Okay, so once that's done, the third dimension that you need to check is if this bracket is positioned mesiodistally on that buccal surface. So if the tooth is positioned too far mesial or too far distal, it's going to cause the tooth to move in an unwanted direction too. So then you will need to adjust to make sure that this is in the center of the tooth. Okay, so once you check the bracket in the occlusal view, the lateral view, and the distance away from the occlusal plane, then you're ready to cure. So when you're doing this in a seminar setting, I would recommend you to flash cure it right away. But if you are doing this clinically, you will actually be bonding the rest of the bracket and then cure. Okay, so what I'm going to do is flash cure really quick, and then I will move on to the next bracket. Okay, so for the premolars, so notice our typodont is missing one premolar. The fours are missing, so we'll skip the brackets on the fours. So the next bracket we're going to be placing on is the fives. And how you use this bracket holder is you squeeze the handle to open the tip, and the handle will have an arrow that's pointing up for the gingival. So if we're going to hold the bracket in a way the bracket holder is designed, this arrow needs to be pointing down. So we will be picking up the bracket like this. I prefer to pick up the bracket as a whole bracket instead of just a half of the bracket. So gingival down, which is lining up with the ball hook of the bracket. So we smear a little bit of the cement on here. Okay, you want to have enough cement on there, and then you do not want to put too much cement, otherwise you'll have too much cement to clean up. Okay, so how this is placed on the bracket, how you place the bracket on the tooth is you will need to hold this bracket and check the orientation of the bracket using this indicator here. So this will indicate the long axis of the bracket when you're holding it, and you need to align it with the long axis of the root. So for the lower fives, you can check the panel and you know the root is definitely not orienting more medial or distal, it's straight down from the occlusal table. So once you orientate the bracket to align with the long axis of the root, you can squeeze open the bracket holder and release. The next thing you like to do is flip the bracket holder and use this pointy side to push on the bracket. So you squeeze a little bit more of the cement out. Then you can use Explorer to clean the cement around the bracket. The last thing is to check the height. So when you are checking the orientation of the bracket with the long axis of the tooth, you can also check to see if this bracket is positioned mesial-distally, right in the center of the tooth. You do not want to put the bracket too distally or too mesially. So if that's the case, you move the bracket slightly without changing its orientation and then position it in the middle of the tooth. So the last thing we do is we know the bracket height is going to be 4 millimeters. So we will put the top of the handle over the occlusal table and make sure the slot fits at the bottom of the height gauge. So because this bracket slot is open, so you will be able to fit this bottom of the height gauge into the slot and move it down. Move it down until the height gives you the proper indication. Okay. So you can also check to see if it's in the same height as the molar, because unless there is too much of a height discrepancy clinical for a certain patient, then if the two teeth are straight, then the slot for the bracket should line up. Okay, so in this case, the bracket slot should be lining up because the two teeth are straight. So once it's positioned in the right spot, you can go ahead and flash cure. But clinical setting, I usually would do all of the brackets and then cure. So I'll just do a flash cure and make sure it stays on. Okay. Okay, so the next bracket we're going to put on is we're going to skip the 4s and we're going to do the 3s. On the lower canine bracket, the height is at 4.5. So we need to pick up the bracket holder that says 4.5. Okay. So the canine have a ball hook pointing to the distal too, and the orientation of the holder should still have the same as the premolar with the gingival pointing down. So you will need to squeeze open the bracket holder, grab the bracket from mesial-distally with the gingival or the ball hook pointing down. And we put a little bit of cement here. Make sure it's on all the surfaces. And position the bracket first to align the orientation using the bracket holder as an indicator for where the long axis of the tooth is. Then flip the bracket holder over to squeeze a little bit of the cement. And also check to see if the bracket is positioned in the center mesiodistally. Okay? And the last thing is we use a height gauge on the other end of the bracket holder to check if this is orientated in the same height. So it looks like when the top of the height gauge is touching the incisal tip on the cusp tip, the bracket slot is right at 4.5 millimeters. So one common mistake that most of the doctors do is they are tilting this bracket height gauge too much in this orientation. Then you can see if you tilt this height gauge tipping too lingually, then the bracket will be placed a lot more incisally. And if you tilt this height gauge down too much, then the bracket will be placed too gingivally. So the key is to align this top of the bracket gauge with the occlusal plane. So you need to imagine there is a plane going from molar to canine, and you do not want to tilt this in either direction too much. So level this as much as you can, and then check again if it's mesiodistally positioned. Check to see if it's lining up with the long axis of the root, and then it's ready to go. Okay. So the next one I'm going to do is the premolars. Sorry, the incisors. The incisors are all going to be 4 millimeters. And incisor bracket are smaller, so you need to be a little bit careful as far as not to hold just half of the bracket tightly. Okay. Again, gingival going down, and you can see the incisor bracket is a little bit narrow on the gingival side than the incisal side. So a little bit cement here. And again, check the long axis of the tooth with the long axis of the bracket first. And the second dimension you check is if it's positioned mesiodistally in the center of the tooth. And the last is to check the height. Again, do not make the mistake of tilting this too up or too down. You need to level this to the occlusal plane as much as possible. Okay, the next one is the lower central incisors. Check the orientation of the bracket to line up with the long axis of the root. Check to see if it's positioned in the middle of the tooth mesiodistally, and then check the height last. And the next bracket is the central incisor on the lower left side. So notice I haven't cured the rest of the incisors, because if the incisors are lining very straight, you also need to make sure the height will be consistent. So it's better to position all the brackets first, check the orientation first, and squeeze out the cement. Make sure it's positioned in the center of the tooth, mesiodistally, and check the height last. Moving on to the next. And then the next one is the canine. So for canine, we're going to change the bracket height gauge to 4.5. Again, check the long axis of the bracket to the tooth. Flip the bracket holder to squeeze a little bit of the cement out. Check the mesiodistal position of the bracket. Make sure it's centered. If there's a little bit more cement, then you can use either Explore or use small scaler to take it out. And then the last thing is to check the height. So after you finish with the lower canines to canine, since these teeth are very, very straight, you also need to check to see if the height is consistent. So you can check to see if any of the brackets are either too low or too high. You can adjust it. Okay, it looks all pretty good. Okay, then I will go ahead and do a flash cure just to stabilize them. Okay. Then going on to the second. Second premolar. Orientate the long axis. Check the mesiodistal position of the bracket, and then last is the height. Okay, and last one is the molar. So we will need to use the molar holder. Again, going from the mesio and hold the entire bracket and apply the cement. So check the long axis of the bracket with the long axis of the root. Then check the mesiodistal position if the bracket is centered. And you have to use the bracket height gauge of the 4mm if you have access to move the bracket down to 4 millimeters. So it looks like I'm almost there. Okay, so once everything, before you final cure, make sure to check the orientation again and to make sure the bracket is aligning with the long axis of the root. Position mesiodistally in the center, and then the height. So the last thing we do is we'll do a final cure of the whole arch. So typically in the clinical setting, I would just do a flash cure real quick around a couple of times, and then go back to each bracket to cure for 10 to 20 seconds, depending on your curing rate. So I will go ahead and finish curing, because next thing we need to do is to tie the brackets. So now I'm going to show you how to tie in a 0.4 night tie and 1825 night tie, and then packing an open coil. So there's 0.14 night tie, and before you fit the wire to the typodon, obviously this is a little too long, so we're going to cut the distal end first. So we're going to use the distal end cutter, and you can cut the distal end this much, and then put the end of the wire down somewhere. So the wire fits over the bracket slot, and then it will go into the molar bracket tube. So you can fit the wire into the molar bracket tube first. And if it's too long, you can keep trimming until it is not, clinically not poking the patient. So once you push the wire into the molar tubes, the wire is stabilized. What we're going to need is the mathel plier that's in the bag. And we're going to need to use the ligature director. That looks like this. Take out the rubber holder on one side. And we're going to need the pin ligature cutter. And then ligature wires. You will also need the pro ties. And then we can use the open coil, stainless steel open coil. And I'm going to take out the 1825, leave it here, okay? So once the bracket are bonded, the next thing is to fit the wire through. You can obviously cut it a little bit shorter clinically, otherwise it will be poking patient. But I'm going to just show you how to tie the pro tie first, and then I'll show you how to use the ligature wire to tie the wire into the bracket slot. So on this 0.14 night tie, you can zoom in. There is a small marker for the midline. You need to make sure this midline is at the dental midline. Okay, the midline on the wire is matching with the dental midline, right between the lower incisors. So, and we can start with a lower incisor first. So when the brackets are first bonded, there might still not be as secure as it can. So what you need to do is hold the bracket down as much as possible when you tie in the wire. So make sure the wire is fitting into the bracket slot. And how we break one of the ties on the pro ties is open up the metal plier, hook, use the tip to grab hold of one and leave a little bit at the end so it can hold the bracket, it can go over the bracket, and then you pull it off. Okay, pull it off the tree. So the first one I'm going to tie is the incisors. So the first thing I do is I hold the wire down with my fingernail. And obviously you can do this with your fingernail, or you can use the ligature director to help you to hold this down. Okay? So you can use a ligature director to help you to hold the wire in place as well. Okay, the ligature director will have a little fork on one side, and then you can use that to secure the wire into place. So what I typically like to do is I will hold the bracket down as well when you first tie in. So first hook the tie wing, one of the tie wing with the pro tie, and then try to hold down both, and then wrap the rest of the pro tie around the other tie wings. And once you have the tie wings over all the 4 tie wings on the brackets, then you can release. Then obviously this wire is tied in with a pro tie. So I'll tie another one, and then we will use the ligature tie. Okay. So again, hold, pull, and I'm going to tie the canine now. So on any bracket that has the wings, you need to hold the pro tie over the hook first, and then engage the other tie wings. Okay. So now I'm going to show you how to use the ligature wire to tie the bracket, tie the wire to the bracket. So the ligature wires have this preformed loop. So the first thing you do is we'll make almost a 45-degree bend. After that bend is made, you can slide the loop either over distal or mesial of the tie wing, depending on what direction you're coming from. So you can use, again, a ligature director to hold the wire in place while you tie. Okay. Or you can use fingernail to hold the wire in place while you tie. So first slide the loop from one side, either mesial or distal, over the tie wing. And once you have the ligature wire over the incisal and gingival tie wing, you can start twisting the ligature wire. Using the other hand, just make a couple. And what I always like to do is I like to hold the bracket and the wire in place with my finger just to secure the bracket. So once you make a couple of loops, then you can pick up a metal plier and click on the ligature wire and start twisting the ligature wires down with the mouth plier. So as you start to twist this ligature wire, you also need to close the loop down on the other side by pushing the loop toward the bracket. So once it's tight enough, then you can let go and you can move on to the next bracket. So again, make a 45-degree bend first, slide it over the tight wing, incisal gingerly. Once you slide it over, it's always better to secure the bracket with your finger. Well, twist with your other hand. Once you have a couple of twists, then you can use your mouth plier to do the rest of the twist. And once it gets a little bit tighter, you can use your fingernail, or you can use the ligature director to push the ligature loop in toward the bracket. Tighten the ligature tie. One more. So the rest of the ligature wire, you can bundle it together outside the patient's mouth and then secure it together, because we're going to be cutting all of them all together. So I'll be tying the rest of the arch on the left side here. Again, make a 45-degree bend and slide the loop over the gingival and incisal tight wing. You can use your fingernail to push this in. Once it's secured, you can hold down the bracket and twist on the other side. And close the loop a little bit more with the ligature director. Or you can hold it down with your fingernail. Loops all together. You bundle all the ligature wires together. I'm going to tie the premolars now. The canines first. So on the canines and the premolars, it will be, because the hook is on the distal, and it will be very hard clinically to work with the patient from a distal, from mesial to distal. We're going to need to try to place the ligature wire over the hook first, and then on the distal of the tight wing first, and secure the wire, then twist. Because your approach clinically for a patient is always from distal to mesial when you're tying in the premolars, and sometimes the canines too. So make a 45-degree bend. So on the premolars, you will need to secure the wire into the bracket slot first. Okay, and there are two ways. You can use your ligature director first to secure the wire in place, and then just hold the wire down. Then pick up the loop. Always go from distal So you're under the hook of the bracket. Secure the wire gingival and incisally. Then you can make a twist. Once the first couple of twists is made, then you can start tying. So you can use a ligature director to continue to push this forward to make it tighter. And finish with a little bit tighter, slightly tighter tie. So now I'm going to show you how to cut the ligature ties and then tuck the ligature tie, the pigtails in. So what you do is you cut about 2 to 3 millimeters. Obviously this is all bundled up at the end, so you hold the loop outside of the mouth and then you can cut individual ones until they're 2 to 3 millimeters long. And after they're cut, these are pointing out, so you will need the ligature director to push those pigtails in toward the teeth. So it doesn't matter if it's over the wire or under the wire, as long as it's tucked in and it's not poking the patient. Okay, so for patient comfort, you can place a pro tie over the ligature tie. And then patient will walk home like this. Okay, so now I'm going to show you how to take this apart. So with the ligature ties, you need the ligature cutter to cut the ligature ties out. But for the pro ties, it's very easy. You hold you loop the either a scaler or a explore over the tie wing and then release. And you can do this on multiple teeth. Okay. So how we gonna cut the ligature out is you need to cut on the distal part opposite of the pigtail, and then you can either use your ligature cutter to pull this ligature tie out, or you can use explore to tease it out and mantel plier to remove it. Okay. So the next thing I'm going to show you is the how to tie a how to place the open coil onto the arch wire. So how we fit the open coil between the bracket is you need to measure the open coil from end of the bracket, one tooth, and cut the open coil. So from one end of the bracket to the other bracket, you need to cut the coil in this length. So the coil length is interbracket distance plus half of the bracket width. Okay, so you'll be cutting it right here. So there are two ways of doing this. You can measure it over the teeth and then take it out of the mouth and then cut it. Okay. And the next thing is you need to thread the open coil over the wire. And keeps coming off. And you secure the wire in place. So the open coil is going to be packed between the lateral and then the canine here. The first thing we need to do is tie one of the bracket down with a ligature wire. And then the little piece of open coil will be pushed and activated. There are a couple ways you can activate this. One is use a ligature director to hold the wire down and hold the coil and compress the coil and then hold the wire down and then secure the wire into the bracket. Okay. We'll use another ligature wire to tie the other side of the open coil. Okay, same thing.